morning, sir.
Good morning.
My name is Crystal. I'm a family nurse practitioner student at Purdue University Global, and I'm going to be caring for you today.
Okay.
Before we get started with the reason for your visit today, I'd like to ask you some general patient demographic questions.
Sure.
Okay. Can you please tell me your name, first name and last initial only,
Kenny B.
and how would you prefer that I address you?
Kenny's fine.
Perfect. Can you please verify your age and date of birth?
I am 47, 7/9/74.
Great. I've noticed that you're speaking English. Is this your primary language?
Yes.
Great. Where were you born?
Union, West Virginia.
Okay. And what gender do you most closely identify with?
Male.
Perfect. What race are you?
White. Caucasian.
Okay. And do you have any ethnicity or culture that you most closely identify with?
Caucasian. American.
Okay. What's your marital status?
Married.
Okay. Do you have children?
Yes. 15 and 18. 2 boys.
Great. What is the highest level of education that you've completed?
I have a master's degree.
Okay. What's that in?
Occupational safety and health.
Okay. And what do you do for your occupation?
Currently, I work for an insurance company, Risk Control.
Okay. Great. And do you have health insurance?
Yes, I do. In my
It's
company.
excellent. All right. So, can you tell me what brought you in today?
The last few weeks, and it kind of happens in the spring and the fall, the last few weeks when I wake up in the morning, I've had kind of a sore throat. I think it's due to kind of allergies and sinus issues. Typically, spring and fall, when I'm spending a little bit of time outside, usually that's when it's the worst.
Okay, and so just to clarify, your symptoms are a runny nose.
Yeah, runny nose, kind of itchy, scratchy throat. It might be a little sore in the morning,
Okay.
but yeah, maybe a little sneezing, but runny nose. Yeah, kind of allergy or sinus related issues.
And this happens when you go outside predominantly.
Yeah, for the most part, and it seems worse in certain times of the year. So I think the last 2 weeks it's been kind of worse with the rain and maybe the mold and the leaves falling and things like that.
Okay. Have you noticed anything that makes this worse?
Really, the more time I spend outside, I think that's the only thing that makes it worse. Yeah.
Have you noticed anything that makes it better?
I mean, staying inside, and I've taken some over-the-counter medication, like allergy-type medication, and that helps a little bit.
Okay. So you've said that you've had a runny nose, kind of sore throat or scratchy throat?
Yes, yeah.
Okay.
And the sore throat is worse in the morning, typically.
Okay. Do you have any other symptoms?
No, not right at the moment.
Okay. If you had to rate the severity of your symptoms on a scale from 0 to 10, 0 being non-existent, 10 being the worst you've ever had, how would you rate these symptoms?
I'd say a 4 to 5. It's more of an aggravation. It's not terrible.
Okay. And you said that your runny nose, the sore throat, they're worse when you go outside. How often does this happen?
It's kind of intermittent, but it seems like certain times of the year it's worse. But the last 2 weeks is when it's kind of really gotten better. I've really noticed it consistently.
And how long does it last when you go outside?
It might last for a few days. Kind of depends on kind of the season and what the weather's like and how much time I spend outside. But usually it's worse for a few days and then gradually starts to go away.
Okay. And what do you think is causing this?
I mean, some type of allergy. I mean, I'm just assuming it's always worse in the spring and fall, so I'm guessing that it would be somewhat related to kind of what's going on outside, pollen or mold, something like that.
Okay, thank you for sharing that with me. So Kenny, during this appointment, I'm going to ask you some questions about your medical history, your personal medical history, your family history, and then I'm going to ask you some questions about each area of your body or each body system to better understand your concerns.
Okay.
I know that this may seem like a lot of questions, but please bear with me
No
as we
problem.
move through. Okay. So in regards to your past medical history, have you ever been diagnosed with or do you currently have any major illnesses or injuries?
No, not currently.
Okay. Have you ever been hospitalized?
I don't believe so.
Okay. How about receiving blood transfusions? Have you ever received a blood
No, I've
transfusion?
never gotten a blood transfusion.
Okay. Have you previously been or are you currently disabled?
No.
Okay. Can you tell me about any childhood illnesses you may have had? This may include things like mumps, measles, rubella, chickenpox, whooping cough, strep throat, anything you had as a child.
I mean, I know I've had the common ones. I've definitely had chicken pox. I've definitely had strep throat. The other ones, I don't think that I've had any of those.
Do you recall about when you had chickenpox?
I took some notes on some of these dates, so I know I probably wouldn't remember them, but I'm thinking it was when I was somewhere around 10, 12 years old. I was fairly young.
Okay.
I was fairly young.
And how about the strep throat?
I don't know that I've had it since I've been an adult, but I've had it probably more than once, but I don't think I've had it in the last 20, 25 years. I don't recall. It's been a long time.
Okay, thank you. Have you ever had any surgeries? And if so, what did you have and when did you have them?
So I've never really had a major surgery. I had a small cyst kind of on the top of my back that I had to have kind of surgically removed. But it was just like a local anesthetic, and I was in and out.
Did they do that in the office?
Yeah, they did it in an office.
Okay, great. And did you receive all of your immunizations as a child?
Yes, I believe so.
And how about your current recommendations as an adult for vaccinations, things like tetanus and seasonal influenza?
Oh yeah, I'm all for getting those.
Okay. Do you recall when you had your last tetanus shot?
Yeah, actually, I had my most recent annual physical in August of this year, and I was due for my tetanus update. I guess it'd been about 9 or 10 years, so I actually just got another tetanus shot.
Okay. And how about your seasonal flu shot?
Yes, I actually got it at the exact same time when I was in the office during my physical.
Okay. Do you have any psychiatric history? This would include things such as anxiety or depression.
No.
Okay. Have you ever been diagnosed with any allergies? And this might be food, medications, inhaled allergies, environmental allergies.
Being around cats is the only one that I've had since I was younger. I did have an anaphylactic shock episode when I got stung by a bunch of fire ants, but that was kind of a one-time deal. I've been stung by them before and afterwards, and it's not bothered me, but I did have a pretty severe reaction at one time.
Okay. Any food allergies?
No food allergies.
Any allergies to medications?
No.
Okay. Are you currently taking any prescription medications?
No prescription.
Okay. How about any over-the-counter medications, either regularly or as needed? This might include things like Tylenol, ibuprofen, multivitamins.
Yeah, I do try to take a multivitamin every day, and kind of as needed. If I'm sore, have issues, I'll take probably ibuprofen's the most common one. And well, the thing I can think of is if I have trouble falling asleep, I might take a melatonin occasionally, but that's about it.
Do you happen to know what the dosage is for your melatonin?
I think it's 5 milligrams.
Okay, great. Do you take any herbal products? This would be things like ginseng, glucosamine, cinnamon.
No, not currently.
Okay. Do you recall the last date of your physical that you had?
It was in August of 2020.
Okay. How about a cholesterol screening?
They actually did that at the same time during that physical.
Great. Have you had a prostate exam?
I have. It's been quite a few years. It's been several years since I've had one.
Okay. How about a urinalysis, a urine test?
I didn't have one in my most recent physical, but I have had one in the past. I just can't recall exactly when.
Okay. Have you had a TB skin test?
Not that I recall.
Okay. Have you had an eye exam?
Yes, just recently, I think June, sometime this spring, I had the first time I had an eye exam in a really long time, and first time I ever started wearing glasses.
Okay. And are those glasses helping you?
Oh yeah, basically just for reading and working on the computer. I can see good at a distance. Yeah.
Great. And you wear them regularly?
Yes.
Okay, great. Have you ever had a foot exam?
Not in my adult life. Maybe when I was younger, as a child or something. But yeah, nothing recently.
Okay. How about dental screenings or dental exams?
Yeah, I try to stick with my 2 times a year cleaning schedules. Yeah, I usually keep up with those pretty regularly.
All right. Have you ever had a hearing screening where they tested your hearing?
I have, but it's been so long I can't even recall when it is. I was probably younger.
Okay. Have you ever had a chest x-ray or an EKG?
Not to my knowledge. No, I don't think so.
Okay. Now I'm going to ask you some questions about your family history. So I'm going to go back to your grandparents. We'll talk about grandparents,
okay.
parents, your spouse, and your children.
Yeah, okay.
So I'll ask you about each person individually, and if you're able, please share with me any conditions, diseases, illnesses that they have, and whether they're alive or are deceased.
Yeah,
Okay.
okay.
So let's start with your maternal grandmother.
Yes. Yeah, she's deceased, and to my knowledge, and I had to check with my mother and take some notes because I wasn't really sure. Most of these died when I was really young, but the only thing that I know that she had was type 2 diabetes.
Okay. How about your maternal grandfather?
I really don't know if he had anything. He was deceased when I was really young, so to my knowledge, I don't know that he had anything.
I'm sorry about that. Do you know his history on your paternal grandmother?
No, neither one of those. They were both deceased when I was really young, and I don't recall or known of any issues that they had either.
And how about your paternal grandmother?
No, I don't think she had anything
Okay.
as well. She's
All right.
deceased too.
I'm so sorry to hear that. What can you tell me about your mother?
My mother, she's had more issues. I mean, she's in her early 80s, but she's had a few issues in the last few years. She's got like a back problem, degenerative type disc disease, and a lot of pain associated with it. I know she struggles with high blood pressure. She did have breast cancer just a couple years ago, but that seems to be controlled right now, and maybe a little bit of arthritis, but that's about it.
And you said she is still living?
Yes, she is.
And you said her age is?
I think about 82,
Okay.
82, 83.
All right, great. How about your father?
Well, he's healthy as a horse. He still works every day, and he's about 70, 74, 75, and yeah, he still works every day and is really healthy. The only thing that I know that he's ever had is high cholesterol. I think he takes daily medication for that.
Okay. Do you know any medical history on your wife?
She does have rheumatoid arthritis. She's kind of struggled with that for a little while, but other than that, I think that's it.
Okay. And you know her approximate age?
37.
Okay. And you said you have 2 sons.
Yes.
Can you share with me about their medical history?
Yeah, to my knowledge, I don't think they've had anything other than my oldest, who is 18 now, and he was 3 or 4. He had his tonsils removed. But other than like an occasional broken bone or something like that, both of them had like a broken arm or broken wrist when they were younger, but they've not had any other medical issues.
Okay. Now I'm going to ask you some questions about your lifestyle patterns. If I'm moving too quickly, please let me know and
No
I'll slow
problem.
down. Okay. What is your current immigrant or citizenship status?
I'm a citizen, yes.
Okay. Citizen of the United
Of
States?
the United States, yeah. Born and
Okay.
raised here.
And have you ever lived in any other country?
No.
All right. Do you have any cultural, religious, or spiritual beliefs that we should be aware of while providing care to you?
I mean, I'm a Christian. I go to a Methodist church, but that's it. No restrictions that I'm aware of.
Okay. And what is your current perception of your overall health?
I mean, I think I'm pretty healthy. I mean, I'm getting older, a few aches and pains and creaks here and there, but I try to stay active. I'm trying to eat a little bit better.
Great. Well, that leads me on to my next question, so thank you very much. I'm going to ask you some questions about your nutritional habits now.
Okay.
Have you noticed any changes in your appetite or loss of appetite?
No.
Okay. Are you satisfied with your current weight?
Pretty close. I have been kind of on a diet and watching what I've eaten a lot more in the last 4 or 5 months, and I've lost some weight, so I'm pretty close to my goal weight where I think I need to be.
Do you know about how much weight you've lost?
About 36 pounds.
Oh, that's
Yeah.
fantastic. And how have you done that?
Really just counting my calories. I got on a program with my wife, Optavia, and we're basically eating small, frequent meals through the day and eating a healthy dinner.
Sounds great. Um, and you said you did say you had about a 36-pound weight loss.
Mhm.
Can you tell me about your usual food intake? So this would be, what does a normal day of eating look like for you?
Usually I will eat a protein shake, drink a protein shake, something like that first thing in the morning. Then I usually eat something small every 2 to 3 hours. So that's usually oatmeal, protein bar, maybe some eggs. Let's see. I mean, that's the most of it. I'll maybe eat a small salad or something like that, some potatoes. But yeah, I try to eat small, frequent, like 150 calorie meals through the day.
Great. Do you have fruit and vegetables? And if so, how many servings?
Typical day, I might have 2 to 3 servings of vegetables. Definitely with the dinner, I usually always have at least a couple servings of vegetables with dinner.
Any fruits?
Very rarely. I'm trying to cut out fruit right now, but I'll probably start eating fruit again soon in the future, small amounts.
Okay. How about whole grains?
Not a lot. I've been trying to watch my carb intake, and I've not been eating a lot of wheat or a lot of bread or a lot of whole grain type foods recently.
Okay. Do you have any food restrictions related to your culture or cultural beliefs or any food intolerances?
No, I don't think so.
Okay. How much fluid do you drink each day?
I've been trying to drink a lot more water. I probably have. Are you talking just water or like diet sodas or everything?
Everything.
Everything? Ooh. I at least drink probably 120, 140 ounces of something a day. It's typically diet soda or water
Okay.
for the most part.
And what is the ratio of diet soda to water?
It was about 70% water and 30% diet soda, but it's getting closer to half and half probably right now. I'm falling off the wagon a little bit.
Okay. So now I would like to ask you some questions about your bowel and bladder health. Okay.
Okay.
So first, how frequently do you have bowel movements?
At least once every 1 to 2 days.
Okay. How would you describe them? And this could be things like they're formed, they're soft, they're watery, the color.
Usually it's formed. Yeah. Usually it's formed in normal color, I guess, brown.
How frequently do you have to empty your bladder?
Where I've been drinking a lot more fluids, it's pretty regularly, probably at least once every hour.
Okay.
Yeah.
Do you have any pain, frequency, urgency, anything like that with urination?
No.
Okay. And have you ever had any episodes of incontinence where you were unable to make it to the restroom in time, didn't know you needed to urinate, or?
No, I've never had that.
Okay, thank you. These next questions are going to be about your current living and working environment. Okay. In what city and state do you currently reside?
I live in Concord, North Carolina.
And how would you describe where you live? Is it urban, suburban, rural?
Suburban. It's in a housing development.
Okay. What can you tell me about your community?
The local community, the Concord, the city,
Sure.
that area. It's a small town on the outside of Charlotte, North Carolina, probably about 20, 25 miles on the northeast of Charlotte, North Carolina. Was a smaller community, but it's growing really fast.
Okay. And what type of housing do you live in?
It's a single family home.
Okay. Do you have city sewer and water?
Yes, we do.
Okay. That you know of, are you exposed to any environmental toxins or chemicals in your home?
No.
Okay. And are you exposed to any occupational or environmental toxins at work?
Not very often. Maybe I did occasionally 20, 25 years ago, but no, nothing now.
Can you recall what those may have been?
I used to have to, I used to work for a contractor, and they worked in some like chemical and steel mill plants, and occasionally there might be a small ammonia leak, but typically it was protected or we didn't go in those areas when there was anything.
Did you wear personal protective equipment when you did?
Yeah, if you had to go in there, you had to wear respiratory protection.
Great. All right, so the next questions I'm going to ask you are about your ability to complete your activities of daily living, okay?
Okay.
So do you have any difficulties independently completing the following activities? It's a long list, so bear with me. Bathing, dressing, toileting,
No.
eating, walking, performing housekeeping tasks,
Nope.
shopping, cooking, doing laundry,
Nope.
using the telephone, managing finances, or managing relationships.
Nope. I'm good.
Okay. How would you describe your family composition?
Composition exactly?
Yeah. So, who do you live with?
Oh, okay. I live with my wife, and my oldest son lives with us and is going to college, and my youngest son splits time between me and his mom.
Okay. And how are your family decisions made?
Me and my wife typically make most of our decisions together.
Okay. Do you have any family illnesses or medical conditions that may impact your family dynamics?
No, I don't think so.
Okay. And what type of interpersonal relationships do you have, and what support systems do you have?
I mean, I have quite a few work friends in addition to my wife and my other family. My parents live out of town, but me and my father-in-law like to go fishing a lot, and yeah, we both have close families, me and my wife. So I think we got a pretty good support system.
Great. Have you had any changes in your ability to remember or recall things?
I don't think so. My wife thinks that sometimes I don't have a very good ability to recall things. It's I don't know if it's selective, but I don't think my memory is as good as it used to be.
Okay. Has your ability to express yourself through speech changed?
No.
Okay. Are you able to see, hear, smell, touch, and taste things the same as you have been in the past?
Yes.
Okay. Now I'd like to learn a little more about your sleep and rest habits. How many hours of sleep do you get each night?
That's been a little bit of an issue with me the last 5+ years. I used to have no problem getting 8 hours of sleep, but here the last several years, I've had trouble getting really more than 7 hours of sleep. 7 hours is a pretty good night of sleep for me. It could be 5, 5.5, 6, but on average, I think I'm getting 6 to 7 a night.
Do you wake up feeling rested?
If I get 7 hours, I feel pretty rested. 5.5 to 6, I really don't. I feel kind of tired throughout the day.
Okay. Do you take naps?
Occasionally when I can, if I don't get a good night's sleep, occasionally I might take an hour-long nap around lunchtime or something like that, and that helps.
Okay. How many times a week would you say that happens?
Maybe twice a week, not that often.
How many pillows do you typically sleep on?
Usually just one.
And I know that you mentioned that you took melatonin sometimes.
Mm-hmm.
Do you use any other sleep aids?
No.
Now I'd like to know about your exercise or physical activity regimen. How often do you exercise and what type do you do?
Well, before COVID happened, I was actually doing really good for a couple years. I went to the gym between 3 and 5 days a week in the mornings before work, but I've kind of had to curtail that with COVID. Hopefully I get started back soon, but really going on walks occasionally or going outdoor activities is about it. I used to do a little bit of weight training and some cardio, primarily weight training, but yeah, the last 6 to 8 months I've really not been able to do that like I used to.
COVID certainly has changed things for us in that way. So now I want to know, what do you do for fun in your leisure time?
Fun. I used to love to play golf. I still do. I just don't get to play as often as I like, but probably the primary activity I do now is kind of go fishing in my spare time.
Okay. And do you travel?
A little bit, not as much as I used to, just locally, maybe in North and South Carolina and surrounding states for work occasionally, but that's been much more limited due to COVID.
Have you recently traveled out of the United States?
No.
Okay. Have you ever traveled out of the United States?
I have like twice. I got married a few years ago in Barbados, and my family went on a trip to London, England when I was like 6 or 7 years old. That's been it.
Okay. The next questions are going to be about your personal habits, okay?
Okay.
Do you use any tobacco products?
No.
Okay. Do you vape or use e-cigarettes?
No.
Do you drink alcohol?
Once in a blue moon, maybe once every month or two, not very often.
And when you do, how much do you drink?
It might be 1 to 2 drinks. That's it.
And are those beer, wine, liquor?
Most of the time, it's either beer or mixed drink, maybe.
Do you use any illicit or street drugs? This may include things such as prescription medications for recreational use, cocaine, crack cocaine, amphetamines, heroin, or marijuana.
No, none of those.
Okay. I like to always check with my patients about any intimate partner violence. So, is there any physical, sexual, or emotional abuse between you and your partner?
No.
Do you feel safe?
Yes.
How are things at home?
Good. Yeah.
In regards to coping and stress management, have you had any major life changes in the past 2 years? This may include death in the family, a move, a change in job.
Not in the last 2 years, no.
When you have changes in your life, how do you handle that stress?
I mean, I think I handle it pretty well. Yeah, none of the things that's happened before has really had a negative effect on me that I know of.
Do you have someone you can talk things over with or talk about any concerns or stressors that you may have?
Yeah, I mean, other than my wife and her sister does therapy stuff, so between the two of them, if I need any counseling, they can take care of most of it, I think.
Great. And you've mentioned talking to people. How else do you relieve stress? If you've had a hard week at work, how do you relieve that stress?
I mean, I think exercise or doing something outside, going for a drive, just getting some outdoor kind of away time, fishing, that kind of recreational type stuff.
Sounds like you like to be outside a lot.
I do. I'm kind of stuck inside working all the time now due to code, working from home. So yeah, I do enjoy trying to get out any chance I get.
Sure, I can totally understand that. When you do those things, does it help you to get de-stressed?
Yeah, I think it does. Yeah, I think it does, definitely.
Excellent. So I ask all of my patients about their sexual health. Please bear with me as we go through these questions. Are you presently in a relationship that involves intercourse?
Yes, I'm married with my wife.
Okay. Do you and your partner use contraception?
Yes.
Can you tell me a little about that?
I had a vasectomy several years ago, and I believe she is using an IUD.
Great, thank you. So this may seem like a weird question. Please bear with me. You've mentioned to me that you have a wife. Is your gender preference females?
Yes, females only.
Okay. Has anything changed recently about your sexual health, satisfaction, or function?
No.
All right, so next we're going to do a review of symptoms, okay?
Okay.
We're going to go over each system of your body pretty much from head to toe.
Okay.
And I know that this is going to seem like a lot of questions,
Yeah.
but it should go pretty quickly. So as I list each one of them, please let me know if you are currently experiencing, have noticed, or have had any of the following.
Okay.
Okay, so we're going to start with generally. Have you noticed any, and I know that you've told me weight changes, so I'll note that in my chart. Have you noticed any fever or fatigue?
No.
Okay. Related to your skin, have you experienced or noticed any rashes, lumps, or itching?
No.
Any dryness?
No.
Changes in color?
No.
Changes in hair or nail texture?
No.
Or changes in the size or color of moles?
No changes. I did just visit a dermatologist recently as well, and they kind of froze off a wart that I had on my arm that had been there for a while, but he didn't notice any issues.
Great, thank you for sharing that with me. Related to your head, have you noticed or experienced any headaches?
No.
Head injury?
No.
Dizziness?
Nope.
Or vertigo?
No.
In relationship to your eyes, have you noticed or experienced any changes in vision?
No.
Eye pain?
Nope.
Redness or swelling?
Nope.
And you shared with me that you wear glasses.
I do wear glasses basically to read and to see my phone.
And they do help, so that's
Yes.
fantastic.
Yes, they do.
Have you noticed any excessive tearing?
No.
Double vision?
No.
Blurred vision?
Nope.
or partial loss of vision or any blind spots in your vision?
No.
Next, I'm going to ask you about your ears. Have you noticed or experienced any hearing changes?
No.
Any ringing in your ears?
No.
Any earaches?
Oh.
Any ear infections?
Nope.
Any discharge from your ears?
No.
Okay. Have you noticed any hearing loss other than the selective hearing you mentioned with your wife?
Nope, that's it.
Okay. And do you use any hearing aids?
No, I did not.
Great. Next questions are going to be related to your nose and your sinuses. Have you noticed or recently experienced any colds?
No.
Congestion?
No.
And I do notice.
Other than the allergy related stuff that I'm dealing with, that's really it.
Great. Any nasal obstruction?
No.
Now you mentioned you had a runny nose. Can you describe that discharge a little to me?
It has been clear. Occasionally when I have these allergy episodes, if they last for a long time, I might get a sinus infection that the color might change. But yeah, here in the last couple of weeks, it's been clear.
Okay. Any hay fever?
No.
And I know you said allergies, you tend to get some seasonal allergies.
Yeah.
You also mentioned the allergies to fire ants, I believe.
Yes, yeah. I did have one bad reaction to fire ants.
Do you keep an EpiPen for that now?
You know what? After that episode, I did keep one for a while, but I don't currently have one. I probably should.
Okay. We may need to address that later.
Okay.
So thank you for sharing that you did have one. Have you noticed any nosebleeds?
No.
Any changes in your sense of smell?
Nope.
Or any sinus pain?
No.
All right. These next questions are going to be in regards to your oral and mouth health. Have you noticed or experienced any bleeding gums?
No.
Mouth pain?
No.
Toothache?
Nope.
Any lesions in your mouth or on your tongue?
No.
Do you wear any dentures, have dental implants, or partials?
No, I do not.
Okay. When was your last dental exam?
Probably May of this year.
Okay, recently.
Yeah, it's been recently.
Great. Have you noticed any sore tongue or dry mouth?
No.
Any hoarseness?
No.
Any altered sense of taste?
No.
And have you had a tonsillectomy?
I don't believe I have.
Okay. In regards to your neck, have you noticed any lumps?
No.
Any enlarged or tender lymph nodes?
No.
Any swollen glands?
Nope.
Have you noticed a goiter?
No.
Okay. How about any neck pain?
Nope.
Neck stiffness?
No, I mean maybe occasionally when I sleep on my pillow wrong, but not anything typical.
That's able to wear itself.
Yeah, a couple days it goes away.
Great. Any limited range of motion in your neck?
No.
And I know this may seem weird as a male, but I do need to ask you about your breast health, okay?
Okay.
Have you noticed any lumps?
No.
Any pain?
Nope.
Any discomfort or discharge?
No.
And have you noticed any tenderness, lumps, or swelling in your armpits?
No.
Okay, great. Next, I'm going to ask you about your breathing and your lungs. Have you noticed or are you currently experiencing any productive cough?
No.
Any non-productive cough?
No.
Any difficult or labored breathing?
No.
How about any wheezing?
Nope.
Any intense, sharp, stabbing, or burning pain in your chest when you inhale or exhale?
No.
Any history of lung disease?
Nope.
Any exposure to toxins or pollution? I know you did mention the
Yeah, I mean, some construction sites I was on 20, 30 years ago, I mean, occasionally I'd be around some stuff. I'd either have PPE on though, or it'd be a really short duration. I've never had any issues or symptoms.
Okay. I do believe you have not had a chest x-ray and don't recall a TB test. Is that correct?
No, I don't recall ever having either one of those.
Okay. In relationship to your heart, have you ever noticed or do you currently have any chest pain or discomfort?
No.
Any heart palpitations?
No.
Have you noticed your heart beating excessively fast or slow?
No.
Have you had any difficult or labored breathing?
No, I have not.
Have you had any shortness of breath or difficulty breathing when you lay down flat?
No.
Okay. Any edema or swelling?
No.
Have you noticed any blueness to your lips, fingers, or toes?
No.
Great. Are you frequently woken up from sleep with the need to urinate?
But not really in the middle of the night. Sometimes that's what wakes me up in the mornings, but I usually don't have to go during the night.
Do Do you have a history of heart murmur?
No.
Any hypertension?
Nope.
Any anemia?
No.
And have you ever been diagnosed with coronary artery disease?
No, I'm not.
Okay. The next question is going to be about your gastrointestinal system. Have you had any changes in appetite?
No.
Any yellowing of your skin or the whites of your eyes? This was called jaundice.
No.
Okay. Any nausea or vomiting?
No.
Difficulty swallowing?
Nope.
Any heartburn?
Nope.
Any stomach pain?
Nope.
Any changes in belching or flatulence?
No.
Any changes in your bowel habits?
No, not really.
Have you noticed any fresh blood in your stools or any black or tarry stools?
No.
Any yellow stools?
No.
Have you had hemorrhoids?
No.
Any constipation?
My new diet is not making things move as freely as it used to, but it's not bad.
Okay. Any diarrhea?
No.
And any food intolerances?
No.
Okay. Related to your genitourinary system, have you noticed any frequency or like you feel like you need to urinate excessively?
No.
And you already told me you did not have nighttime awakening to urinate.
Yeah, no, typically not.
Okay. Any urgency, like you have to go right now?
No.
Okay. Any blood in the urine?
No.
Any incontinence?
No.
Any pain with urination?
No.
Have you noticed any changes in the caliber of your urine stream? Is it a steady stream or is it interrupted?
No, it's steady.
Do you have any urinary hesitancy?
No.
Any dribbling?
No, I don't think so.
Okay. Have you had any hernias?
No, I've never had a hernia.
Okay. And you've already mentioned to me that you haven't recently had any changes in your sexual habits, interest, or function.
No.
Have you noticed any discharge from or sores on your penis?
No.
Okay. Any testicular pain or masses?
No.
Do you perform a testicular exam on yourself?
I haven't in quite a while. I guess I probably should do that.
Okay. And do the doctors perform testicular exams on you?
Not normally.
Have you had any HIV exposure that you're aware of?
No, not that I'm aware of.
All right. Okay, so this is related to your peripheral and vascular system. Okay. Have you noticed any cramping, leg pain that's induced by walking or exercising?
No.
Any extremity coldness?
No.
Any numbness or tingling in your extremities?
Nope.
Any leg cramps?
Nope.
Varicose veins?
Nope.
History of blood clots?
I don't think so.
Discoloration of hands?
No.
Any ulcers or sores on your extremities?
No.
Related to your musculoskeletal system, have you noticed or experienced any muscle or joint pain?
Nope, other than muscle soreness if I work out or overexert myself, but that goes away quickly.
Any joint stiffness?
No.
Any history of arthritis or gout?
No.
Any limitations of movement or history of disc disease?
No.
Neurologically, have you noticed or experienced any fainting or passing out?
Nope.
Weakness?
Nope.
Paralysis?
Nope.
Any history of stroke?
No.
Any history of numbness or feeling like you have tingling pins and needles?
No, not normally.
Okay. Any tremors or tics?
No.
Any involuntary movements?
Nope.
Any coordination problems?
Nope.
Memory disorder?
Nope.
Mood changes?
Nope.
Or history of mental disorders or hallucinations?
No.
Okay. Have you noticed any of the following? History of anemia?
No.
Easy bruising or bleeding?
Nope.
History of blood transfusion or reaction?
No.
Lymph node swelling?
No.
History of exposure to toxic agents or radiation?
No.
Related to your endocrine system or your hormones, have you noticed any heat or cold intolerance?
Nope.
Any excessive sweating?
Nope.
Any excessive thirst or hunger?
Nope.
Any excessive urination?
Nope.
Have you had any changes in your glove or shoe size?
No.
Okay. Any history of diabetes?
Not with me. No.
Okay. History of thyroid disease?
Nope.
History of hormone replacement?
No.
Any history of abnormal hair distribution?
No.
Regarding psychiatric or mental health, have you experienced any nervousness,
No.
anxiety,
Nope.
depression?
No.
Any memory changes?
No.
any thoughts of harming yourself or harming others?
No,
Have you ever attempted suicide?
no, I have not.
And do you have any history of mental illness?
Nope.
Great. Thank you so much for answering all these questions. This will allow me to tailor your treatments based on your personal history. Moving forward, we'll only need to update these, so future appointments will take less time and will be more focused on what brought you in.
Okay, great.
We'll be moving to the physical assessment portion next.
Okay.
I'll be back in just a few moments.
All right, thank you.
Thank